Three states are now offering COVID-19 booster shots to all adults. CDC officials recommended limiting boosters to those most at risk, but officials in California, Colorado, and New Mexico say that they are hoping to prevent a possible surge in cases during the holiday season. This comes as COVID-19 hospitalizations rise in more than a dozen states. CBS News' Michael George has more.
This is really a critical moment in the pandemic. It has never been more dangerous for the unvaccinated than it is right now.
To fight back, Governor Jared Polis will allow Coloradans of any age to get a booster, following California that took the same step the day before. And in other states, there are calls to go beyond the age restrictions the Centers for Disease Control has required.
I would recommend it for all adults, and I'm hopeful that we soon have that policy here.
Massachusetts, where Dr. Paul Sachs works, saw daily cases go from 79 in July to over 1,700 a day this week. The numbers are increasingly typical of COVID's unpredictability.
We're in an odd place where we may be seeing a version of our future. And I don't say that with any great joy, because we still have 25,000 cases a day and 1,000 deaths a day in the United States.
Dr. Robert Wachter is chairman of the University of California, San Francisco's Department of Medicine.
As I look at the forces that are going to make things better, more vaccinations, boosters, vaccinating the kids, maybe some new medications coming. I also see some counterbalancing forces that make things worse. People becoming less careful, immunity waning. I kind of think this may be a version of our life that we experience for the next few years.
COVID hospitalizations rose in at least 14 states last week over the week before. Michigan is at a 6-month high. And in unvaccinated areas in Minnesota, regional hospitals are overtaxed.
We are essentially at 100% capacity. We've been that way for weeks.
And there's fear the holidays ahead will bring anything but joy.
My advice going into the holidays is that anybody who's unvaccinated should get vaccinated. If I could wave a wand and have everybody vaccinated within a week, this would go away.
Joining us now is Jodie Guest. She is a professor and vice chair in the epidemiology department at the Rollins School of Public Health at Emory University. She also leads a COVID-19 outbreak response team for communities across Georgia. Welcome, Professor Guest. Always great to have you on the show. So I want to get your take on these three states that are now allowing all adults to get COVID-19 booster shots, even though the CDC is only recommending them for those most at risk. Do you agree with California, Colorado, and New Mexico officials and their decision to expand booster availability?
Well, I think when the CDC recommended boosters, one of the things the advisory committee said to them is anyone who is at risk or feels they're at risk, and all three of these states have very fast increasing rates of COVID-19. And that, coupled with going into the holiday season when we know more people are going to be getting together, we know more people are going to be inside, I don't think that it is unreasonable to say anyone 18 and older can get a booster in these states with very high spread of COVID-19.
An appeals court on Friday upheld a ruling that blocks the Biden administration's vaccine rules. Those rules would have required vaccinations or weekly testing for staff of businesses with 100 or more employees. How are vaccine requirements affecting the number of COVID-19 cases and hospitalizations?
Well, what we've seen is places that do have vaccine requirements, vaccine rates are going up. And that's exactly what we want to see from them. It is unfortunate that this is currently blocked, but I think it will continue to be discussed in the legal system. What we know is that vaccines work. And what we know is that we want everyone vaccinated as soon as possible. And that is our way to get to a place where we're willing to live with an endemic level of COVID-19 that is not causing so much death. And so anything that we can do to get people to vaccines is important.
So after going down nationally for a while, we're now seeing these COVID hospitalizations rising in at least 14 states. Do you worry that we're going to see another major wave this winter?
I do. What we know is that COVID-19 has not been done with us yet, and it is hard to predict at all times where it's going, but we are currently plateauing at a level that is too high for us to be comfortable. And so we should be concerned and continue to talk about why we need to be vaccinated, how protective it is to be vaccinated to keep us from getting severe disease, hospitalizations, and death, as well as talking about how to stay safe with non-pharmaceutical interventions, such as continuing to mask when you're in large crowds and when you're in areas with high spread, staying away from each other, making sure you know the vaccine status of the people you're with. And then also really important is to make sure that we're testing regularly as well. All of these things are going to help keep us safe as we go into these holidays. And we want these holidays to feel different than they did a year ago. And so, we just really want to see people get to vaccinations as quickly as possible so that we can keep our entire communities safe.
Let's talk about the future of COVID. We're hearing many health experts say that it's likely we'll be living with COVID indefinitely. I'm hoping you can help us better understand the reason why. Smallpox was eradicated, polio was essentially eradicated. So what is keeping us from really getting rid of COVID-19? Is it largely due to resistance to vaccines, or are there other factors that make it different from smallpox and polio?
Well, I think at this point in time, we're not at a level of vaccination that we could even talk about eradicating this. And every single person who is not vaccinated is a place that we can continue to see spread of COVID-19, and spread of COVID-19 leads us to potential more mutations. And that has the ability to undermine our vaccinations. And so it's this continuous vicious cycle. What we do know is that we will probably be living with coronavirus at some level and an endemic level. But what I strongly suggest is that we cannot accept the current level as our endemic level. We cannot have 1,000 deaths a day in the United States be something that we accept, and it's something that we're willing to say, this is okay, and this is how we're going to live with this virus. We need to continue to do everything we can to stop the spread of this virus. And that really is a combination of vaccines and our non-pharmaceutical interventions and combining them with testing. And so this is not a level where we want to live with COVID-19 the rest of our lives, and we should not let it be that.
All right. Professor Jodie Guest, thank you for joining me, and thank you for all that you do.
Thank you so much for having me.